Welcome to Cancer Talks with tumor tamer Rajeev. Dr. Rajeev Vijayakumar, a seasoned medical oncologist and a hematology specialist, is known for his ethical and cost-conscious leadership in cancer care and bone marrow transplant. Hello, doctor. Thanks for doing this series for us.
Thanks.
Right. Cancer is a formidable disease presenting significant challenges for both the patients and the loved ones. Questions galore during this time, and this series is dedicated exactly to answering those questions. In this first episode, let's start off with the best of the questions that the patients have asked.
Let's get going.
Right, doctor, here we go. Is there a cure for cancer? What is the best way to prevent cancer?
Okay, so this is a common question that all of us get asked, like all medical oncologists, surgical oncologists, radiation oncologists. So yes, there are cures for cancer. There are multiple cures for cancer. And many times, if you are able to identify the cancer within the first stage or second stage, and many times within the third stage, you can cure the cancer completely, prevent it from coming back also. If it is stage 4, that means from the particular organ it has gone to some other organ systems, like from a kidney cancer has gone to the lung, or a stomach cancer has gone to the lung, liver, then it is not curable, but it is controllable. Like how we would have diabetes, hypertension, thyroid problems like hypothyroidism. So you don't have the if you stop your sugar medicines or your BP medicines, your BP and sugars are going to jump up, right? Similarly, for a lot of cancers, for stage 4 cancers like breast cancers, lung cancers, prostate cancers, we just treat with only tablets. We don't give any chemo also. Only treat with tablets, and it has become very similar to a regular chronic disease like diabetes or hypertension. So yes, many cancers, we do have a lot of simple tablets, we control it. So it becomes like a regular chronic disease, and patients carry on with their lives. So for us, basically for a patient, if there is a patient doesn't have any symptoms of the disease and is able to carry on his or her own life, carry on all the activities of daily living, do everything that they've been doing, that is what they want. And that is what they get.
Nothing like it. Absolutely lovely to know that people can carry on with their normal life despite cancer.
Perfect.
Right. Doctor, the next question is, why do most people suffer from cancer these days? This was completely unheard of. Not more like, even 15 years ago, we didn't have too many people have it. But today, every second, third person or every family seems to know at least one person who's got cancer. Why is it spreading?
Well, it can be thought of in different ways. One, either earlier we were not detecting enough. People were dying earlier and we didn't know. Liver problem आयतो, there was some problem. वो थोड़ा सा पेट में पानी भर गया, छाती में पानी भर गया, and पता नहीं गुजर गया. So this is what we've been hearing over the last so many years and decades. So we probably didn't detect enough. Therefore, we didn't know it was cancer. Therefore, people died. You know what was the average age of Indian male in the year 1921? 1921 there was a census. What is the average age? Guess. 37. Imagine 37 was the average age. So now if I was there in 1921, so I probably have already passed that particular prime age of living. So that used to be. Then with time, with each passing year and with advent of science, we started living longer and longer. I know many of us will say, oh, my grandfather's father, he lived for 100 years, 200 years. Those were few and far in between. The average, when you see the average Indian male, it was 37. Now it's come up to, guess what? It's gone up to 71. So therefore, with time and with advent of science, we've been able to identify what causes death. Like hypertension was the biggest killer. Diabetes was the next big killer. All of these led to heart problems, strokes, and people would get uncontrolled diabetes, uncontrolled sugars, would get strokes or heart attacks, and then afterwards they would die because there was nothing that could be done. But now, after you control these, then comes another set of problems. You're living for a longer period of time. So therefore, if your car, let's consider your ambassador car, is very beautifully well-oiled machine. After some point of time, the plastics in the handles, then the mats, they all start chipping off.
Yes.
So therefore, it is something similar to that. We were not used to living for this long. This particular era, this particular generation of human beings, we are living the longest average life. So therefore, there are a lot of diseases which come along with that and cancer being one amongst them. Well, I know you might ask me that question that, oh, there are so much of cancers in younger people.
Yes.
So therefore,
yes.
How do you justify that? Now we are living longer. There's so much of advent of technology. There's so much of natural resources we have been utilizing from nature, and that man has invented so much. Man has invented industries, petroleum, plastics, cell phones, and a barrage of other inventions have come in, which actually have blended with us in our regular life. It is like a thread in our regular fabric of life that we cannot remain away from it. These are the necessary evils which are there, and many times we don't even realize it is a necessary evil, and neither do we want to know that it is an evil.
True.
In many times that we
True.
just don't want to know. We're like, okay, I'm enjoying life, I'm having a good time, that's it. I'm living long. There are a lot of advents in science, so to give me a good, luxurious life, and there are also advents in medicine. If I have a problem with that, I will be able to tackle it. So therefore, if you ask me, the pollution, everyone talks about pollution, everyone talks about environment change, but actually it is one of the major drivers. Tobacco, well, it has been much more limited right now in terms of you don't find people smoking regularly in your regular restaurants or in a hospital. It used to be the same scenario around 15-20 years back. If you go to a cinema hall, it will be filled with smoke. Now it is not so. People would chide you for that, saying that do not smoke in a cinema hall or in a public space. So that's changed, but overall, when you see the amount of carbons that are emitted, all of them, they would cause small mutations inside our body, and then when finally it's that one single small push which would actually trigger a domino effect. You know how a dominoes, right? You've seen those videos. You press one chip, every chip starts falling and forms into a pattern.
Right.
Similarly, over there, this domino effect of all multiple small mutations would lead to a bigger picture, and then finally lead to it triggers of the cancer. So therefore, it's not a single factor. It is multifactorial. It is the chemicals that we inhale, the food that we eat, everything, right from the rice that you eat is filled with chemicals, in the sense to prevent that, to ensure that you have good yield. There are a large number of chemicals which have been put inside. And then to ensure that the mites don't eat it, again it is filled with a lot of chemicals and fertilizers. And to ensure that a particular area of land grows that much amount of crop and yields so much of rice, so much more chemicals which is put inside. So therefore now comes the concept of organic farming as well. But you see, all throughout our childhood, all of us have been ingesting chemicals on a regular basis. From every packaged food, there's a class 2, class 3 preservative which is put. What is a class 2, class 3? Then there is a artificial flavors and artificials but accepted flavors which is put in every box or packaged item. So anything that we consume, right from the fruit drinks that we things. Have you ever thought that the fruit drinks, your Maaza, your Sprite, and your all the other your slice, it tastes the same every single time. Every time that you drink an Amul milk or a Nandini milk, it tastes the same. How is it possible if they are getting it right from the farmer to the packet?
Right.
It is all processed, because this processing would ensure that you maintain a similar taste. And when you have to put some chemicals to get that particular taste, once you get that, like right from your tomato ketchups, you know that this particular brand has this particular taste. Tomatoes, are they all growing in the same fashion? Aren't they subject to different variations in climate, size, color, the ripeness, etc. But you get the same taste. That's because of these chemicals. These chemicals we are ingesting on a regular, daily basis. Therefore, it is bound to affect us. Where is the doubt? We are living in an era of convenience where I want everything. I want something like that. Same taste. I'm not willing to compromise on anything. I want the same taste. I want the same quality wherever I go, whatever I do. So therefore, to cater to this human greed, humans have actually created all of this. Naturally, we have to succumb to this at some point in time. The bubble has to burst.
Then, Doctor, we have the next question, which is very close to what you said. What lifestyle choices can increase the risk of developing chronic diseases like cancer or heart disease? As you said, one is the food part, which has got a lot of chemicals ingested. What are the other things that will lead to it? Because we have seen a lot of people who exercise also, still have cancer, right? So what are these things which are lifestyle choices that people make apart from food, which can lead to cancer?
Okay, like in the Mahabharata, you have kathas and you have upakathas. So therefore, to explain the katha, the person would say a lot of small upakathas, and finally it lead to that. So similarly, when you see here the lifestyle changes. So if you have a person like I've seen in my practice, you'll have some people who come as smokers and some people who are non-smokers, teetotalers, and they would get the disease. The smoker would get the disease as well. And the person who's had a lavish lifestyle, drunk, smoked, did this, did that, everything, and he gets a disease, he will have the disease for a small period of time, he'll succumb to it very fast. Whereas the teetotaler, the body's resistance is so strong, it will prevent him from dying. He will live a longer life. He will live a much more stronger life. So therefore, when you see these lifestyle changes, that in terms of someone who's exercised, it's like same when we have in Munna Bhai MBBS, where Akram says it's like मैंने एक दारू नहीं पिया, smoking नहीं किया, एक लड़की तक नहीं छुआ, मेरा girlfriend भी नहीं, मगर मुन्ना भाई मेरे को क्यों cancer, stomach का cancer आया. So this is something, this came out when I was in first year MBBS. So this is the first film that we actually saw when we entered into MBBS. It was told by a teacher, first see the film and then come. That's when you become not just doctors, you have to be good human beings. You have to be a humane fellow. So when this question that is asked, that always rings continuously. It's like, why did Akram get stomach cancer despite being such a teetotaler? The fact is that if an Akram gets a cancer, he will be able to tolerate the therapy better. He will have a better outlook. He will have a better prognosis. Where it hits, how it hits, no one knows. Like I told you regarding the number of mutations, that mutations can be in any combination. Some combination might trigger that cancer domino faster. Some patients, it might trigger it later on in life. But at some point of time, it may not. A person might outlive that particular mutational cascade as well. So when you ask me about now lifestyles, so a person with a good lifestyle in terms of a regular exercise, drinking a lot of water. Now this is common stuff. Regular exercise, drinking a lot of, everyone keeps saying the same thing. Diabetes, hypertension, stroke, thyroid, knee pain, headache, everyone. Even for growing hair, they will say that, okay, fine, de-stress, do a lot of yoga, meditation, do a lot of this one and that one. And then afterwards, everything, your hair will grow. It doesn't seem to be working in my case. But nevertheless, so when you actually look at this, well, that's the truth. If you do all of this, there's a very good likelihood you're going to postpone it or prevent it from occurring. But the eventuality, if it has to occur, it will occur. You'll be in a better situation. If you've had a disciplined life, like in the Indian Army, we have a very, very strong saying that if you sweat in peace, you will not bleed in war. Similarly, if you had a disciplined life all throughout your life, if catastrophe strikes, you will not be left high and dry. You will know how to handle it. Your body will know how to handle it because it's been a well-disciplined machine. So similarly, if you had a good lifestyle, very high chances that you'll be able to come out of your therapy successfully. If that actually answers the small upakathas to the main katha, saying that you need to have a good lifestyle. As all of us know that good exercise, at least an hour of exercise, good healthy foods, a lot of water, a lot of vegetables and fruits, and then afterwards, if for non-vegetarians, lean meat and fishes, but not to try to cut down the red meats and the heavy meats as such, because again, the heavy meats causes a lot of colon cancer and stomach cancers. So now you can ask me another question about what kind of meats is non-veg
yes, I was about to say.
Yeah, see, you know what is the okay, now I will talk to you about whether meat can cause cancer. What are the cancers caused by meats? It's mainly colon and rectal cancer. What is the incidence of colorectal malignancies in India versus colorectal malignancies in the Western countries? In India, it is between 6 to 8 per 1 lakh. That is around 1 lakh, 6 to 8 people might get colon cancers. In the West, it is around 35 to 40 per 1 lakh. Agreed, India was few years back a very strong vegetarian background. In the recent past, there's 80% of our Indians consume meat, but we don't consume meat to the extent as much as the West eats. In the West, they would eat meat for breakfast, meat for lunch, meat for dinner. Whereas in our country, many of us, probably due to cost or due to our habit and due to our culture itself, many of us would eat meat once or twice in a week, and most of the times it is in Basim Bhai's shop on Sunday. It will be full. It will be filled with lots of chickens and goats hanging around. It will be paraded over there, and then afterwards it will all get sold out by evening. That's generally Sundays are the days when our Indian people eat meat. So they limit it down to such a small quantity. Hence, it actually helps in curtailing us to develop such colon cancers to a larger extent. Whereas in the West, it's on a regular daily basis that they consume meat. So therefore, there's a very high chance, and it's been very well proven. If you eat meat for too long, it causes a large amount of colorectal malignancies.
Great point.
Thank you so much, Doctor. With that, we come to the end of this episode. If you have questions on cancer or you know anybody who needs help with cancer, feel free to reach out to Dr. Rajeev on the WhatsApp number 7975301470. I repeat that, it's 7975301470. We will make sure that your questions are answered in the subsequent episodes. Thanks for watching.